What's up, mamas? I'm Dr. Marcy Crouch, board-certified women's health physical therapist, and today we are talking all about sex after baby. I'm going to teach you why sex can be painful. I'm going to help you get through those uncomfortable conversations, and I'm going to give you some tips on how to make sex better and not as scary after having a baby. Something that is very surprising for a lot of mamas after this 6-week appointment is that their doctor or midwife tells them that everything is good to go and you're cleared to have sex with your partner. And I think a lot of times we don't feel ready for that. And we can not feel ready for lots of reasons. For me, I remember thinking hello, was I the only one in the delivery room? Did you just not witness what just came out of there 6 weeks ago? No way is anything going in there at this time. So I think there's a couple things that we need to kind of break down about this sex after baby and the 6-week mark. One is that it's completely fine to not feel ready to have sex after 6 weeks, whether it's C-section or vaginal delivery. Totally fine. There's nothing that says you have to jump back under the sheets at 6 weeks postpartum if you're not feeling ready. If you are feeling ready and you want to give it a try, there are some things that we need to kind of discuss before doing that to make it as successful as possible. But one thing that I would like to kind of just throw out there is that a lot of women and birthing people report pain with intercourse the first time they have sex after having a baby. So this is very common. One study shows, 90% of women report that. That doesn't mean that it's normal. Okay. And there are a few reasons why sex can be painful after having a baby. And I'm going to kind of break those down for you right now. There are 3 main reasons. One is a hormonal component. After we have a baby, our hormones go bananas. And if you're breastfeeding or pumping, we have a lack of estrogen. And estrogen helps the tissue around the vaginal canal and the opening to the vagina be very soft, fluffy, moisturized, pliable. Without estrogen, the tissue becomes very frail and very dry and like a postmenopausal vulva. Okay, we actually have a name for this. We call it vaginal atrophy. And when we're trying to put something into the vaginal canal on tissue that is very dry and fragile, doesn't always feel good. I lovingly refer to this as sandpaper vagina, if you catch my drift. And we're going to kind of talk about what to do about that in just a minute. But a hormonal component is very, very typical, especially when we don't have our kind of normal, quote unquote, cycles back because we don't have estrogen. Okay. A second reason why sex can be painful after baby is a pelvic floor muscle component. And this is a big one. Okay. Your pelvic floor muscles have just gone through a crazy event. And I'm not just talking about the delivery or the birth. I'm talking about 9 months of holding up and carrying a baby. Gravity, a growing placenta, a growing uterus, increase in blood flow, increase in fluid volume, your body weight, all of these changes for an extended period of time. And that's a lot of load on skeletal muscle. So it's very common to have almost like shin splints or an overuse injury in your pelvic floor muscles after having a baby. And think about muscle pain. When you have spasm or you have strain, that can contribute to pain because those muscles are sore. The third reason is the result of any type of trauma or vaginal tearing or stitches or scar tissue that can be residual from any sort of repair. So perineal tearing is common during vaginal delivery, and it's a surgical procedure to repair those tears. Same with C-section. C-section is a major abdominal surgery, and because those incisions are so close to the vaginal canal and that sensitive vulvar tissue, we get a lot of referred pain and a lot of distant pain and dysfunction kind of up and down or kind of in further places from the incisions. And a lot of my C-section mamas experience pain with intercourse. So those stitches and that scar tissue that can lay down after having a wound or a repair can cause a lot of pain. They can be big pain generators because scar tissue kind of has a mind of its own. It goes wherever it wants. It can bind down nerves. It can cause nerves to be hypersensitive. It can disrupt the way that the tissue moves, and scar tissue itself can be very painful. So when you're trying to put something into the vaginal canal and you have all three of those things kind of compounded, scar tissue, nerve sensitivity, pelvic floor muscle dysfunction, hormonal component, that can be a recipe to not have great sex or to have painful sex or to feel like things aren't going well. So what do you need to know to have the best experience before diving under the sheets when you're ready to try sex after having a baby? So I'm going to give you a couple of my trade secrets, and they work. And this is what I think everybody should know, and they're super easy to do. So first one is lube is your best friend. You can never have too much lube, and we are of the age where we spend money on high quality lube and eye cream. Okay, so no more drugstore lube. You need good, high quality, water-based lubrication that feels the best on postpartum skin. And you need to apply it 3 places. One on you, on the outside of the vaginal canal. Second place on your partner or whatever is going into the vaginal canal. And the third place is inside the vaginal canal. And you do this with an oral medicine syringe, like an infant syringe. You fill it up with lube, you squirt it into the vaginal canal, and now you have lube everywhere, and it makes it like an ice skating rink, which is what you want. The second thing that you need to know is there are some positions that are more pelvic floor friendly for those first couple times, okay? And I'm going to give you 3 of them. One of these positions is what we call the T-bone. So this is kind of how it goes. You're laying on your back. Okay, this is a great position for you to be in so you can practice on relaxation, deep breathing. You're not having to hold yourself up against gravity, and the pelvic floor can really just be allowed to release and be soft. So you're laying on your back, okay? Your partner's pelvis is right at the vaginal canal, and your whole partner's body is perpendicular to you. So the both of you are making a T shape, okay? And you can either kind of like drape your legs over your partner's pelvis, or you can kind of have like a wider position. You might have to play around with it a little bit, but the goal is that both of you together make a T shape and that you're able to kind of just relax on your back and be heavy in terms of like your limbs. The second position is one where you're standing and your partner is coming from behind. And I really like this position because you are able to relax and support your upper body over the bed or the counter or the couch or whatever you choose. So if you're standing and you can kind of build pillows up on top of the bed or the couch, you can just lean forward and rest on that position, okay? And what that does is it puts your pelvis across gravity, so your pelvic floor muscles don't have to work to kind of hold yourself up. This is a trick here. If you turn your toes inward a little bit and do what we call internally rotate your hips, that helps widen the bottom of the pelvis and encourages the pelvic floor muscles to lengthen a little bit more versus toes out or external rotation. That can encourage the muscles to be a little bit more contracted or more tight. Third position is good old missionary. This is where we have pillows underneath your pelvis or your booty. So you're kind of slanted backwards a little bit. So gravity is helping take weight and pressure off of your pelvic floor. Okay. And this is where you have pillows underneath your booty and pillows underneath your knees, like your legs are out in that butterfly position, and you're able to just really rely on the support from the pillows, and you can practice on breathing and lengthening and relaxing. And again, you don't have to utilize any of your core muscles to like hold yourself up or really contract, because the whole point of having something going internal into the vaginal canal is that the muscles release and open. And remember, it's okay to not feel ready at 6 weeks, but the most important thing is to have this open communication with your partner. And sometimes what I do too is I have my clients just take vaginal intercourse off the table, okay? It's important to be intimate and it's important to connect with your partner, but maybe sometimes the thought of having vaginal sex is like too much. So there can be a lot of other things that you can do that we call outer course. So we take away that kind of anxiety or that feeling of like, oh my gosh, I have to start something that I don't want to finish and I'm not ready to do this. And everybody has the same kind of expectation. So super important to have open communication, try those positions, try the lube. So something to think about is that if every time you're having pain with any sort of vaginal penetration, if you're noticing bleeding afterwards, if you can't physically accommodate whatever is going into the vaginal canal, if it just won't go in, you feel like you're hitting a wall, if you have pain or soreness afterwards that can hang around for a few days, if you're noticing a change in your urination, burning frequency, those are all signs that the system is not working properly. And I think this is so important that we don't need to like just kind of grin and bear it and get through this painful experience. Sex should not be painful. So if you're still experiencing symptoms like that, or if it's been 8 weeks, 12 weeks, 6 months, 18 months, and you're still having pain with intercourse, that's a sign that we need to really kind of focus our efforts on whatever structure is causing you the most pain and make sure that we're getting past that. And that's where seeking guidance and help from experts like me or the Down There Doc team is so important, because we are really the best people to help you get through these musculoskeletal contributions to painful sex. And I have had clients who have been having pain for years, and it's never too late, and you never have to feel like this is how it's going to be forever. All right, mamas, I hope that was helpful for you. I know that the conversation of being intimate again after having a baby can be super awkward, and just remember you're not alone and we are here to help you. So if you're loving this, if you feel like you need more help, more guidance, I would love to have you into our community, Thriving Mamas, and into our program, Down There Done Right. It's a great community. We're in there all the time helping mamas get through things like having painful sex after baby. And it's designed for moms just like you who need to bounce forward and not backwards after having a baby. So it's a great group and community if you're newly pregnant, if you just had a baby, if you're 6 weeks postpartum, if you're 5 years postpartum, 10 years, 15, whatever the case may be. It's really for any mom who's experiencing any type of symptom of pelvic floor dysfunction, like leaking pee, pain with sex, prolapse, core weakness, all the things. So if it sounds right for you, I'd love to have you in. Hit the link, join us, and I will see you in the community.